consistently receive national recognition for its quality of care. Brian is a CPA and has a master's in business administration. Would you all please welcome Bian Ivie.
Can you all hear me without the microphone by any chance? Because I would not want to block these wonderful slides that you're all going to see. I want to thank you all for having me here today. I always look forward to being able to talk about my favorite subject, healthcare. Becky was telling me that the last speaker was actually Mayor Johnson, who came and spoke about the Kings and all the exciting things about the arena. Becky said, "I'm sorry, you have to follow him." Well, I actually say he was probably standing up there thinking, "Darn, I gotta go before Bian Ivie." Because, you know, healthcare is far more exciting than any arena. And frankly, it impacts every single person in this room. And we're at a time of change now for healthcare where I think Mike said that nobody really knows what's going on, and there's some truth to that. But we are certainly trying to do the right things to prepare for the future. And again, in an area that does impact us all on a daily basis. So we're in a time of change. And unfortunately, this timing of this change comes on, some people say the tail end, some people say the middle of pretty significant financial issues that we're facing with our economy and as things go. So this economy is actually having a very negative impact on what we're doing in healthcare as we prepare for the new frontier and where we're headed. So let's talk a little bit where we are right now. And this is not going to all be about healthcare reform, because not a single one of you would be awake when I completed this discussion. But it is very important to understand what's going on. As we all know, the Affordable Care Act was signed in 2010. It improves access to care. And the great thing about this program, or about the act, is it also focuses on high quality care, which is a benefit to every one of us in terms of receiving that care. It protects consumers, it addresses rising healthcare costs, good for you, bad for me, because I'm the one that gets to pay for a lot of this, which I'll talk about in a minute. And there's a lot of challenges going on based if you're, frankly, if you're in a red state or a blue state right now. I do have on very, very good authority, and this is the truth. The Supreme Court has already voted on the constitutionality of a couple of parts of the act. And that was the president of my organization, Lloyd Dean, who's the president of Dignity Health, was actually with Michelle Obama the other day. And they were actually pretty close. And he was talking to her and said, "Come on, Michelle, you've got to tell me what the vote was, the results of that vote." The reality of it is she doesn't know and President Obama doesn't know. So you can rest assured there are zero leaks in the Supreme Court when it comes to the votes that are taking place. We're supposed to find out in June what's going to happen, but I thought that was pretty interesting how this has already been decided, and we're just kind of in this waiting mode. So most people think that the whole act is being challenged. Most people think that it's the constitutionality of the entire act is in question. The reality of there's only two parts that are being challenged right now, and that has to do with the individual mandate, which pretty much forces us to have a certain level of coverage, a certain amount of coverage, and also Medicaid expansion, which is another way for providing additional coverage for those who currently do not qualify or can't afford it. That is because of those two, there's also talk about severability. What's going to happen if one of those is found unconstitutional? What happens to the rest of it? Where are we? Because there are some real positive things about the act that people are starting to see the benefit of. The young adults being able to stay on their parents' insurance policies longer. That's a positive for people. People are very favorable towards that. The pre-existing conditions barrier no longer exists. It's now gone. Cost can no longer be determined based on your health history or other factors. It can be judged, or it can be determined right now based on your geography, your sex, do you smoke, and there's one other. Smoke. I'll think about it in a second. The number of members of your family who are going to be on the policy. That's it. Nothing else can be taken into consideration. Most people feel that that's positive. And then we're talking about this wonderful stories you heard about the weight loss and being healthy and staying out of the hospital. Well, in reality, I want you to stay out of the hospital. I like to meet you and talk to you here. I don't want to see you in a patient bed. If you do, I'd like you to pay your bill, but that's a whole other story. We don't want to be under those circumstances. So healthcare reform also focuses on the process of getting and staying healthy. And it's going to expand those services and mandate some of those services that are being provided to you all, or will be provided for free, including comprehensive women's services, very important things to help keep people, early diagnosis and keep them out of the hospital. Closes the Medicare Part D gap. That really is, it's the donut hole. What that is, it has to do with pharmaceutical coverage for Medicare beneficiaries. So there's some real positive things that are going along with the change. Unfortunately, there's also a lot of challenges. Now, the good thing for you all is, again, this is a positive as a healthcare beneficiary, somebody who's going to receive benefits. As somebody who provides benefits, that's where the difficulties come. That's where the costs are. We now, hospitals now have, for dollars that we typically collect from the Medicare program, are going to be, a portion of them are going to be at risk from now on. So in other words, I get a certain chunk of dollars taken away, and then I get to earn them back if I do well based on specific quality metrics. From a hospital standpoint, that's terrible. From your standpoint, that's good, because it forces hospitals to focus on quality and to focus on continuing to improve that quality. It also talks about forces linkages. Right now, the insurers, the physicians, and the hospitals, for the most part, are siloed. We're separate. Now, there are certain exceptions to that. Kaiser is certainly one that is a little bit different, but we're all in our own little silos. Well, the new approach is going to bring us all together. We work collaboratively to make it better for you all. We have aligned incentives. We have a focus on, again, keeping you out of the hospital. If you're in the hospital, we're going to get you out timely. When we get you out timely, we're going to be sure you have the aftercare coverage to be sure that you don't get readmitted, and that you continue to improve. That's a collaboration that, as we sit here today, really doesn't happen for all parties involved. So it's a good thing. The bad thing is, with all these new people who are going to be insured, all these people who are now can't qualify or don't qualify for coverage are going to have coverage, they need doctors to provide care. This is the one biggest issue that we have. We don't have enough primary care physicians to take care of the newly insured. We don't have enough primary care physicians right now to take care of the people who currently have insurance. If you're a Medi-Cal right now, searching for a primary care doc, you've got difficulties in town. And that's what has to change. Unfortunately, if you need care and you don't have a primary care physician, where are you going to go? Your trusty dusty emergency room, which, as you all know, is right now, emergency rooms are still very crowded and have a lot of issues facing them. So that's an area that we have to face in terms of reform. Plus, a lot of people are thinking, with all these changes and what's been going on in the economy, most people think that healthcare is bulletproof. They think that, they can last a recession. It doesn't matter. People have to receive care. The real issue is, however, people are, and my joke earlier was really kind of truth, people expect and frankly deserve high quality care. But without the ability to pay, I still have the mission and the responsibility to provide that care. Both regulatory-wise, if it's an emergency, I have to provide care, and thankfully the Sisters of Mercy ensure that I provide that care regardless of somebody's ability to pay. But there's a challenge in doing that we have to face in terms of the overall healthcare effort. Those of you who do have insurance, there's higher bad debt incidents. My bad debt has gone through the roof. It's gotten very high for people who don't really have the ability, not the desire, but the ability to pay. So it's an area of focus. And then people also, it's another compounding issue, is if somebody can put off a surgery right now, they're putting it off. The slowest people in town right now are the plastic surgeons. Because if it's not a priority, people are delaying it. They don't want to be out of work. They don't want to pay the deductible or the co-insurance. So it really is an impact, and it's a vicious circle that we are facing. So it continues. The good news is many experts feel that we are working our way out of it. I happen to be one of those, not an expert, but that's my belief. But the bottom line is employment is still up, foreclosures are still up, uninsured rate continues to grow, and the state budget deficits continue to grow. So that's the good news that we're facing in terms of healthcare in our environment. That's a little bit of a joke. It's the bad news. So we've got to find some questions. What do we want to do over the next 10 years? Where do we want to be? How are we going to get there? What do I need to do as a hospital administrator providing care and services to this wonderful community? What do I have to do to stay ahead of the game? And probably the biggest question, will the Kings ever win a title? And if they do, that was in there before I realized that Ernest Johnson spoke last week, but that was my question. So I'm a Lakers fan, I'm sorry. Yeah, don't you think I'm not used to getting that response? So in addition to all we're talking about, I do have a Kings jersey. I literally bought an authentic Kings jersey the week before Bibby got traded. It's not as Anyway, that shows you my timing. So with all of these changes, in addition to the economy, the pricing is changing, and Medicare is paying us less. Our commercial volumes are declining because I talked about people putting it off or not having insurance any longer. 2 years ago, it might have been gainfully employed. Wonderful insurance, now they're unemployed, their COBRA has run out. And it really is a dire situation. And most people think, well, you know, Mercy San Juan, they're not for profit. They don't have to turn a profit. Well, the reality of it is, we don't have to turn a profit in terms of we don't keep shareholders happy or anything, but we do have to reinvest in some specific resources, our employees being one of them. And some of you might know today there was some informational picketing going on at Mercy San Juan relating to our pending union negotiations with SCIU, who represent about half of our hospital. And their contract is up on April 30th. I guarantee you will hear more about this over the coming weeks because we are right now about as far away as two people could be. And with all that I've been talking about and the declining in the reimbursement, our revenues going down, nobody, if you think about your individual businesses, you cannot afford your revenues to be declining and your expenses to continue to go up at a 7-8% per year level. That's what we're facing as an organization. So as you hear more about this, our goal is to still provide quality care, access to our hospital, but we are having to deal with the issues right now. And the good news is once we settle the SCIU arrangement, the nurses who represented, their contract is up next year. So at least I have this gray hair now. Next year it might be a little different. It might be completely gone. So we're facing these kind of things on an ongoing basis. And so I'll skip that one because I wanted to get right to this. As I talked about in terms of our labor, and if you think about your businesses. A hospital to be able to maintain its level of performance year over year needs to have their salary expenses be about 46 to 48% of their net revenue. That's pretty high when you think about it. Well, I will tell you, Mercy San Juan's is a lot higher than that, a lot higher. And so we are definitely facing some issues. And again, I only put this up here because I believe in transparency, and as I don't want you to see on the news and hear about this informational picketing or hear about what could be a work action coming in the future, and you think, that Bian Ivie, he lied to me. He didn't say anything about this. It's a reality that we're facing, so I wanted to be sure and get that out there. So while we go through this, we're looking at the future, and what do we have to do? I believe an organization cannot shrink to greatness. You can't cut costs to do better. You have to grow and you have to provide high quality care. Plain and simple. That's been my motto, and it will continue to be that way. We've made a lot of improvements over the last couple of years, and it wouldn't be a great talk if I didn't talk about some of these, okay? Again, as a healthcare consumer, your biggest focus should be on quality. The quality you're going to receive in a hospital. God forbid you ever need to go into a hospital. And I'm very proud to talk about all the great things that Mercy San Juan has done. Big focus on top decile performance in the nation. That's being within the top 10% of hospitals within the country. That's our goal. There are several metrics right now where we're there. Until we get 100% of our metrics in the top 10%, we're not where we need to be in terms of an organization. Core measures simply deals with, I know it's a little bit difficult to read, but Medicare has decided that there are 3 key diagnoses that need to be looked at specifically in terms of a bunch of different quality metrics. Has to do with acute myocardial infarction and heart failure and pneumonia. So those are the three areas typically looked at through organizations throughout the country. And I mean, and this is the kind of hospital that Mercy San Juan is, a top quartile, again, top 25%, goal of 96, 96, 96, 96. Mercy San Juan, 100, 100, 198. That should mean something to you as a healthcare consumer and as a member of this community. And frankly, it's something that we're very proud of. Most people, and I've said this before when I've gotten to speak in front of you all in the past, most of you, when I say I'm from Mercy San Juan, you have an emergency room story. And again, I think I said the last time, when people say, hey, I was in your emergency room, I go, okay, because you know, usually it's not going to be positive. Now, I've been surprised a lot, I must say, a big surprise. But here is our area of focus for the emergency room. And my company is very, very focused on the quality of the emergency room visit. And that's how long does it take a patient to get to see a physician? That's critical. How long does it take a patient to be screened for sepsis? Because my company is very, very focused, as a lot of organizations are, very focused on sepsis and the damaging effects on people. And how quickly is somebody going to take my vital signs and just be sure how I am? So these three, we have set up goals in terms of percentages. And for the most part, it's 75%. Our goal is 75% of every visitor to that emergency room sees a physician within 15 minutes, within 30 minutes. 15, God, would that be great? So 75%. Right now, since we started the effort back in January, we're at 86% of our patients see a doc within 30 minutes. Again, that's a great start, but we need to be higher. Screen for sepsis, within 30 minutes, our goal is 80%, we're at 96%. Because we're very focused on that. And full vitals taken within 15 minutes is about 96%, and the goal is 85. So we're very, very focused on getting you in, providing that care, and frankly, getting you out as quickly as we can. So we're also focused on patient satisfaction because, again, a hospital can provide the best quality in the world, but if your patients don't have a perception of the care they're receiving, how they're being treated, you lose, okay? This historically, in complete honesty, has been an issue for us. People who come through our emergency room typically had to wait longer. It jaded them. We've got the best care in town, without a doubt. But if people act hurried while they're doing it, or they don't show the compassion that you would frankly expect out of a Catholic hospital, people come up with a little different opinion. So this has been our area of focus. We do rank very highly, I must say, thankfully, with our physicians, our communications with our docs, communications with our nurses, communications about medications, which people have a big issue with. They don't know what they're taking it, why are they taking it, and what are the side effects. It has a whole perception on their care. And responsiveness of the hospital staff. We've implemented a lot of things to be responsive to the needs of our patient. We've also started a couple of campaigns focused on pain management, because people want to come to the hospital, they want to get their information, they want to know what it's going to take for them to get out of the hospital, they want you to treat their pain, and they want you to be quiet while you're doing it. That's what people are looking for. So we started the Hush campaign, which has been very successful. I had a better name, it was just the Shut Up campaign, but people didn't like it. Because we need to treat people need to think like they're in a hotel, frankly. They need to be treated like that, they need the quietness to help in the overall caring. So we're focusing on quality, we're focusing on patient satisfaction. As I talked about, the big secret to the future is on growth. And I always love talking about the bells and whistles of our hospital, and it's not because the machines are that important. What's important is you have the high quality physicians who know how to push the buttons on those machines. And that's what makes Mercy San Juan so different. You don't typically see out of a 370-bed hospital these types of services. The lung and esophageal program, the best in the region. We do more services and more levels of thoracic cases than any other hospital in town, including Davis, which is quite amazing when you think about it. The Mako robotic orthopedic surgery unit that deals with partial knee replacement and hips. It's new, it talks about alignment, it helps in terms of overall quality. We're the only provider in town, and I will tell you the results from some of these surgeries will blow your mind how quickly people recover and how they feel about it. We also had some new toys like the 40-slice CT scanner, which is the far less radiation for those people who do have to have a lot of CTs, it's very important. We decided to put that in place. And the Mercy Neurological Institute, again, one of the better kept secrets around is Mercy has the premier neurological science service line in the region. And it's accessed through Mercy San Juan, Mercy General, Folsom, Woodland, Sierra Nevada, all the way towards the Bay Area, to Southern California, all the way down to Bakersfield. That's the level of services that we're able to provide, not only to meet the needs of our community, but to help others who might need the need, or need to have their need met. So we're very, very proud of it. Just because I know you're tired of hearing me talk, I will just say there are a lot of different other areas that we are continuing to grow on so we can raise the level of the services that we provide. I will say one of the things that was not intentional but has happened is Mercy San Juan has become a destination hospital. Because of these high-level services and the positions that we have, we're getting people from out of the area, in some cases out of the country, who are coming to choose to have the procedure done at Mercy San Juan. That's very atypical for a non-academic institution, but again, that's where the quality comes in, and that's where the partnership with our wonderful physicians come in. And in enhanced telepresence, we're able to use our robot here, started with Neuro, to provide care to patients who might not even be in one of our Mercy's hospitals, might be another hospital, might need the access to a neurologist or a neurosurgeon. It started with Neuro and quickly expanded, and now it's focusing on perinatology, so moms with high-risk babies, psychiatric, intensive care units. That's what's happening, and that's the future of healthcare and what role we're playing in. And then the two biggest things that you should all just be sitting there saying, oh my God, I can't believe they're actually doing this. Two new pieces of equipment. Construction started this week, actually. A new biplane angiography suite, and this, 21st century thing is a lifesaver to people who have issues, particularly brain aneurysms, subarachnoid hemorrhages, brain bleeds. This piece of equipment, again, and the docs to support it, will be in place and operational. Everything goes well by September, and so I think that's a real plus for the community. And then also our 3 Tesla MRI, the first one like it in town. It's a wide bore 3T MRI, so it's very fast, takes really cool pictures, and if you're over 175 pounds, you're going to be a heck of a lot more comfortable in this thing. Rather than having the gantry right here, as you can see. It's a great deal of space. And the thing I really didn't realize is, for those of you who had an MRI, you know how noisy it is. It's the quietest MRI on the market. And it's going to make quite a difference for people who have to go through that, the unfortunate experience. So here's how it looks like for all of us. I talked to you all about cost and quality and value. Our whole issue is lower cost, higher quality is good for you. Okay, that's called a value proposition, and that's been our area of focus. I talked about the integration of care amongst third-party payers, the insurance companies, the physicians, the hospital, your individual caregivers, how we can be integrated to improve the level of care is something you should demand out of your healthcare provider and your healthcare organizations. Access of full spectrum of care, again, that's something that I believe the more that we can provide, if it's the right service and we do it well, it's good for our community and it's good for the members of our community. Why have to go to UCSF to get something done when you can get as good or better care right here at home in Carmichael? So I think that's important to us. And then strong strategic linkages with major insurers, and that should just be not just major insurers, but with insurers to provide collaborative health management. Again, that goes back to the whole thing, stay out of the hospital. And that's what is different now. We didn't talk about that 10 years ago. 10 years ago, we wanted a lot of high census. We don't now. We need you to stay healthy. And if you should need care, we need to be sure that we provide the service to be able to take care of you. So with that, I usually have a picture of my dog at the end, but I put a little girl in there. I frankly think my dog Scooter, but that's a whole different story. I do want to thank you for the opportunity. I mean, really, all kidding aside, as this might not seem like the most exciting thing, it truly is important to us all. And as you all get older, I am not, but as you all get older, you're going to need care. And I honestly believe deep in my heart that this will be the best hospital at Mercy Center. go provide. So with that, I am completely done.